Hello, everyone, and welcome to our Connected Health Summit. Very happy to have you back for the first time this year. And if it is your first time attending, welcome. This series of events is focused on health and health technologies, really looking at new innovations and keeping patients and consumers engaged. The theme of today's discussion is health tech revolutions, taking a special peek at the world of connected devices and strategies. If you haven't met me before, I'm Kristen Hanich, Research Director here at Parks Associates. I lead our coverage of digital health generally, as well as a few other areas. I'm speaking with different folks across the industry, designing our research initiatives. Before we get started, I'd like to give a special thank you to our sponsors for making this event possible today, including Alarm.com, Becklar, Calix, and FTP Software. Your support is very much appreciated. In terms of the agenda for today's discussion, I will be kicking things off with a preliminary look at some of our upcoming research on the topic of health devices and services. This presentation will be followed by a talk from our keynote visionary speaker, Winzeler, President of Becklar Personal Health and Safety, moderated by Parks Associates' own Dr. Jennifer Kent. Finally, at 11:45 Central Time, we'll be holding our panel discussion, where we will be taking a closer look at market developments and business models and strategies required to thrive in today's digital health market. Joining me for this discussion are Dr. Davis, co-founder and chief medical officer at PreventScripts, Natalie Schibell, VP of Marketing Strategy, Intelligence, and Insights at Zyter TruCare, Tomas Serval, CEO and co-founder at Baracoda Daily Healthtech, and Davide Vigano, CEO and co-founder at Sensoria Health. Over the past year, we have seen three main trends really emerge and take center stage. These include wearables reaching majority adoption among US internet households, strong interest in advanced health and safety features and functions, and an emergent market for safety and security solutions among the young and fit. Wearables have reached nearly 50% adoption among US internet households. Nearly half of US internet households own and use a wearable health device, defined as a smartwatch, fitness tracker, or GPS sports watch. This growth has been led by smartwatches and the smartwatch market, even as connected health as a whole has hit a lull, and adoption of other product classes such as fitness trackers and GPS sports watches declines. This data indicates that a tremendous percentage of the US population is already actively participating in data collection around their health and physical activities. Helping to drive this market consolidation around smartwatches and wearables is high consumer interest in having multi-purpose health products and fitness products. People who are in the market for connected health devices report a general preference for buying a single product that is multifunctional, but might not be the best at everything, such as a smartwatch, versus multiple best-of-breed products that might provide a greater accuracy. When we asked consumers who own wearables why they own and use these products, we of course found a variety of answers. But by far the most common response was that they had their wearable for health and wellness purposes. They were using it specifically for the data collection around their health and physical activities, seeing this as very valuable to them. When we asked consumers who were planning on buying a new wearable about their willingness to pay for tested medical features, we found that almost 90% were willing to pay more for a model that had the following: clinical grade blood pressure detection, low blood oxygen detection, ECG, EKG functionality, and glucose monitoring. Blood pressure detection in particular was highly attractive to prospective customers who are looking for an unobtrusive and low-friction way to get reliable data on their blood pressure and share it with clinicians. Speaking of data sharing, many smartwatch owners are interested in sharing their health data with their care providers, with about half rating automatically feeding their smartwatch data into medical records to be appealing. Only about a third of smartwatch owners say this automatic data sharing is unappealing to them, likely due to privacy concerns. When we look at consumer-reported appeal for digital health devices overall, we see that this level of interest is actually fairly consistent with overall consumer interest in sharing personal health data collected at home, indicating that consumers are very open to digital health applications and data sharing. The appeal of sharing health data is on par with the appeal of telehealth consultations, as a general frame of reference. One new use case that we saw emerge over the past few years is also this idea of personal safety devices, products and services that automatically call for help in the case of an emergency. Now, this isn't a new idea per se. The PERS market has been around for many years, largely serving seniors with fall detection solutions. What is new is growing penetration of this class of solutions into the consumer market. 20% of our survey respondents, US internet households overall, report using a device or an app that will automatically call for help in the case of an emergency. Most commonly, this is a smartphone app, but we do see also that the smartwatch is the second most adopted product serving this niche. When we dive down into who is using these types of solutions and why, some very interesting results emerge. First, our survey data shows that the younger a consumer is, the more likely they will have adopted these safety devices and apps. 40%, that's right, 40% of 18 to 24-year-olds report using a device or app that automatically calls for help in the case of an emergency, versus just 13% of those aged 65 and older. The key drivers we've found for people to adopt safety devices and apps, listed in order, are general peace of mind, safety when exercising outdoors, such as running, hiking, or cycling, monitoring an elderly loved one, monitoring a child's location and safety, monitoring a wearer with a chronic health condition, dangerous situations such as walking alone, and being a lone worker or on a night shift. On a similar note, we are seeing entirely new types of devices emerge and burst into public interest. Consumer adoption of smart tags, which allows users to track objects, animals, or people, have grown 62% in just 2 years. This is over 4 million new households adopting this device class, which speaks to the demand consumers have for these different types of classes of applications. In summation, we have seen that high adoption of connected health devices, especially wearables, are creating a new opportunity for data collection and data sharing. Consumers are willing to pay for advanced health features and medical-related functions, blood pressure in particular highly in demand. Whoever gets this right has an enormous opportunity in front of them. Also, safety and security solutions, although they benefit seniors quite a bit, probably shouldn't be limited to them. There's an enormous interest and demand among younger folks, and adoption by younger folks will remove some of the stigma that seniors face. Will anyone be embarrassed at using a fall detection solution that their very active grandchild personally uses and recommends? Thanks everyone so very much for joining me for this presentation. The study that these results came from, Wearables, Advances in Health and Safety and More, will be available in July. Coming up next is our keynote visionary speaker, Brock Winzeler, President of Becklar Personal Health and Safety.
Hi, thank you so much, Kristen, for that great research that you shared with us, an overview on the topic today. I'm Jennifer Kent, Vice President of Research with Parks Associates, and I'm so pleased to introduce our visionary spotlight speaker today from Becklar. We have Brock Winzeler, who's the President of Becklar Personal Health and Safety. He joined Becklar in 2015 to lead the newly acquired Frias business. If you're not familiar with Frias, they're one of the leading PERS brands on the market, and Brock is responsible for the growth of the platform and services, as well as he's working very closely to build relationships with others in the industry. So Brock's the guy to reach out to if you want to work with Frias and Becklar. So we're going to hear first a little video from Becklar, and then we'll hear from Brock.
In life, there are moments that matter, where time slows down and seconds count. What if you could react faster, expand time using AI? Where AI-assisted awareness and vigilant human response for the fastest and most appropriate intervention can make the difference. At Becklar, we are innovating the future of AI-assisted critical event monitoring and response. Our category-leading AI-assisted technologies can be integrated with all devices, sensors, wearables, and video sources to create custom solutions for enterprise monitoring, workforce safety, and personal health and safety. Our patented AI-assisted engagement process accelerates decision-making and supports our critical response experts. Becklar natural language processing helps to assess the situation. Our AI response copilot prioritizes response and suggests action based on Becklar AI models, trained, tested, and proven by millions of monitoring center calls across all event types, resolving non-emergent events autonomously, while critical events are sent to human operators, with AI-assisted context and response protocols to alert emergency services and contacts for best possible outcomes. With Becklar's AI Human-in-the-Loop Engage platform, used in critical event response centers across North America, we don't just monitor theft, we help prevent it. We help mitigate harm before it happens and improve outcomes with more timely human response in the moments that matter. At Becklar, we are committed to supporting our customers every second of every hour of every day. Innovating the future of AI-assisted critical event monitoring and response, and creating solutions for a safer world.
Awesome. Thank you, Jennifer, and thank you for the introduction. It's great to be here today, and we're so grateful for our partnership with Parks and the opportunity we have to share some of our insights around this space. As was mentioned, we'd like to take an opportunity to present today some comprehensive connected safety solutions that go beyond typical elder care. And before I introduce some new use cases, I'd like to take a brief moment and introduce Becklar and some of the solutions that you saw in that video. As shown in that video, we are serving businesses and subscribers in three distinct verticals: monitoring, workforce safety, and personal health and safety. We have 8 5-diamond UL listed monitoring centers throughout North America that support all of our critical event monitoring use cases. And we provide services to 2 million subscribers and have sold over 1.5 million devices. And we are protecting lives and property across North America in the US and Canada. At Becklar, we absolutely love our dealers and our partners. And as we are often providing our innovative monitoring, PERS, and workforce safety solutions through our dealer networks, we're doing this behind the scenes. So our dealers and partners, they put their trust in us to provide these services. Our integrated safety platform allows our partners to have access to a market-leading device portfolio, which you saw in that video with both wearables and pendants. And we are launching new devices regularly and innovating on the devices that we have. We also have innovative apps that support the unique features of our services and customer engagement that is extending our services beyond your typical reactive approach to PERS and into proactive action. All of this is supported by our unmatched dealer support, intuitive business insights, and easy-to-use platforms that can be both used online and via API. And as Kristen mentioned earlier, Parks research illustrates that there are motivations for adopting emergency devices beyond elder care. And at Becklar, we recognize this need and considered how could we leverage our connected safety ecosystem and expertise to improve the health and safety of individuals in other markets. In critical moments, every second counts, and a lot of our business is built around seconds. And so our solutions are supported by our AI-powered platform, and we are using this Becklar AI-powered Engage platform to accelerate response through AI-assisted awareness, assessment, and prioritization of actions. And this ensures the fastest intervention. As you can see here on this slide, there's just a few use cases that we support through our connected safety ecosystem and critical event response centers. And in the subsequent slides, I'm going to talk a little bit more about how we're innovating and pivoting to provide services to other verticals and industries that need help in the moments that matter. At Becklar, we have found that while we protect many people and many situations, oftentimes the people that are providing critical service to others also need protection themselves. And so we have decided to extend our services that we've traditionally used to protect the aging population to now protect others, even those that are serving the aging population. So I'll talk briefly about two use cases that, in this case, that we've innovated to extend our platform to support other groups. The first one is a group called People in Need. People in Need is a nonprofit organization that we are working with, and they are providing humanitarian aid to critical regions around the world, even in the Ukraine. People in Need had a challenge keeping track of their team members working in hostile areas, communicating with them, helping them to avoid other hostile areas or areas that have become hostile, and getting head counts or check-ins. So with our connected safety solutions and our digital worker safety platform, we are providing people in need an easy-to-use tool that helps them to keep track of their workers at all times. And they are able to do this using our GPS and check-in features. The tool also allows them to use our geofencing capabilities to mark areas that should be avoided or that have become hostile or are looking to become hostile. Using our dashboard, People in Need can see who has responded to check-ins and who hasn't. And if a worker encounters a hostile situation, they can activate their application SOS to request help and notify the team or our monitoring center that help is needed. And for the second example, we have witnessed an increasing, we'll go back one slide still, sorry. And for the second example, we have witnessed an increasing need for protecting social workers that are in the homes of at-risk individuals in North America. So Becklar recently contracted with a state government to provide emergency services for over 1,700 social workers. And in this case, we provide a very discreet Bluetooth safety button that pairs with the worker's smartphone and our workers and with our applications. And so if they're at someone's home and they're having an in-home visit and the visit escalates to a dangerous situation, using that discreet safety button, they can press the button and create an alarm, which will send help to the worker when that help is needed most. Both of these use cases have extended our ecosystem to serve new markets and improve safety. So now let's talk a little bit about how we've extended our platform to protect thousands of workers that find themselves in risky situations. And as you would expect, while we're protecting workers from your traditional slips, trips, falls, and other emergency events, we have a new use case that is having a major impact on North American worker safety and compliance. Workers across the world suffer from heat-related illness, which can even become fatal. And so our heat stress tools are helping to protect workers and prevent accidents from happening. Utilizing the wet bulb globe temperature, the most accurate representation of what the human body can actually experience in hot environments, we are able to provide useful information to workers and to help prevent and even mitigate heat-related safety incidents. Safety managers can go into our applications and they can outline the type of clothing that is being worn, the exertion levels, and even the identified heat zone from no heat risk to extreme heat risk. And workers will receive notifications that will help the worker to plan for the environment and the work that is to be completed. So we spoke to our customers about heat-related illness, determine what we could do to make our solution even more effective. And as a result of these conversations, we've added some customizations to our tool that go beyond even what OSHA recommends for this type of notification. And this makes our tools more effective for the workers. For example, our latest release allows companies to customize message frequency so that it doesn't become noise in areas with consistent extreme heat. This innovation backlog that we have is driven by our needs of our customers, And this is supported by our experience in protecting people across many platforms and verticals. At Becklar, for those of you that know us or that have met us, we are known for protecting nearly 1 million individuals in our aging populations through our network of dealers. We are very grateful for the opportunity we have to serve this population, and we take it very seriously. Our experience in knowing what is needed by this demographic has helped us to partner with senior living technology companies to enhance the experience for their residents. We're talking mostly about independent living facilities. And while we provide the typical PERS and fall detection services, we are also partnering with these companies to provide proactive care to residents of independent living facilities. This proactive care allows us to report back valuable data like steps or first motion of the day to loved ones and even resident operators. Our tools can be used to reach out to residents to identify other valuable data sets that can help to assess if they're okay and even create a wellness score. For example, if the resident has started to move less than they are used to moving, or if, for example, they've been walking 4,000 steps a day and they begin to only walk 1,000 to 2,000 steps a day, our platform can pick up on these changes and we can initiate contact with the user to start asking them questions through our automated Engage platform. We might ask them questions like, how did you sleep last night? Have you taken your medication? Do you have an appetite? And based on responses to these questions, we may want to take further proactive action to protect and serve these individuals. We may even indicate to the resident operator that this individual's wellness score has decreased. And so we are using our engagement platform to determine if there's a risk or identify opportunities to take action on potential risk so that we can avoid the slips, trips, and falls that may happen and get them help when it's needed most. So these innovations just represent a subset of the work that we're doing to support our growing list of use cases to be there in the moments and matter. And I want to thank, again, Parks for the opportunity to share some of our insights with you today. And I'd be happy to take some questions.
Brock, thank you so much. And yes, a great reminder to the audience that you are able to put questions into the Q&A tab, or there's also a chat tab. Our staff will see that and pull those questions in for us. Brock, thank you so much for kind of giving us that overview, and especially interesting how your services are expanding to kind of new areas. Interesting to see or to hear whether or not the attention and rise in digital health generally is starting to open up these other opportunities where other markets that maybe weren't really thinking about using digital tools or IoT devices to track worker health or safety going into homes. You mentioned social workers, huge deal for private duty nurses, right? Home care, hospital at home, we're sending healthcare workers into the home now and thinking about their safety. How is the kind of general rise of digital health really impacting the PERS market?
Yeah, that's a great question. I think that previously data was not maybe as accessible or available, and as data and technology has advanced, previously, when we started out 30, 40 years ago, businesses had a button in a box. It was calling through a landline. That evolved into the early 2010s where we were getting devices that could send information over a cellular network. And then companies started to think about what else can we add to this device beyond fall detection. And so then it's evolved into activity monitoring and step tracking and even up and about alerts. And now we're moving into, well, we have these devices. Why are we only using them for emergency response and just reaching out to why aren't we reaching out to the subscriber and engaging them to gather more data? And it doesn't have to be through the actual emergency device itself. It also can be through through text or email or through their home phone. But to gather more data to assess how are they doing, can we get information that will assess, that'll help us to prevent these slips, trips, and falls before they happen. And in the worker space, it was a natural shift and a natural pivot. What we saw in the worker space is, in some cases, we find companies that do really have a duty of care, and they want to protect their employees. They want to make sure they're healthy. They want to use it as a recruitment tool to make sure that they know they care about them. Other companies have been, seeing the risks and have even experienced risk events. And so we do have people reach out to us and say, we had an event, we had a worker that fell, they had a heart attack, they sat alone. And this is a true story. We had a worker in a large, million+ square foot manufacturing facility, had a heart attack, sat on the floor for 7 minutes before anybody noticed him, while people were hustling and bustling right around him. And so these are the types of events that we can protect against, and that we're seeing use cases for today.
So we have a couple questions coming in from the audience. One actually kind of focusing back into the home. It's interesting because, the PERS devices really started in the home to give folks, especially seniors living alone, perhaps, the ability to call for help and reach out. You highlighted, moving into the senior care facility. One of the audience members wants to know, what use cases can you share around smart home or examples within the smart home context or at home monitoring, which is, a great core place. What can you give us kind of the state of the market and what's evolving right there in the home?
Yeah, great question. And as I mentioned, a lot has changed. And at the core of what all of us do in this space is we do provide that emergency response, and it is supported by monitoring centers across the United States that are able to provide that response. There are new technologies available that are, again, active in collecting data to assess the well-being of the users. Probably the best example I can give is, if you have a loved one that you're not able to be close to them, or you're living in a different state, we are seeing some loved ones or caregivers wanting to have a better sense of what's going on. And so I'll talk briefly about what we are doing in the home, but we have a caregiver application, and that application allows a son or daughter to log in and see what's going on with mom or dad. And some of the best use cases we have is obviously the activity monitoring, the steps tracking that I spoke about. But we also have geofencing, and so it's helpful to see for the son or daughter that mom has left home, or they're coming back to home, or they've arrived at the VFW or the Elks Club or wherever they go to regularly. And so these activities that they're coming and going are helpful. There is some other technology as well out there. There are companies that are tracking users through motion sensing, through RF, through sensing in the lamps to determine presence in a room. For example, some folks that may need more advanced care, they want to see when they're going into the kitchen, or when they're going into the bathroom, and they're performing their activities of daily living, and that they're tracking those events. And so we have partnered with companies in this senior living space that it has the ability to track these types of events, presence detection in rooms, or even sleep detection, being able to track when they're laying on the mattress versus when they get up, how often they're getting up during the night to use the restroom. And so with access to IoT platforms and IoT devices, the amount of data that we can track is really endless. I will say, in all of that, one thing that is probably a challenge for companies is how do we get all of those different components into the home? And so we are seeing success with PERS based, and the added features that come with PERS, like steps, fall detection, and wellness questions, because it's an easy to install solution. Some of the other solutions can be a little bit challenging to install and monitor, and so adoption can be a little bit tricky, but extremely valuable when it's done properly.
So kind of related to that point, kind of focusing on the smart home, and then we'll move up to some other questions. One of the questions was that, if you look at kind of the state of smart home staffing and even investment, right now a little constrained or down, as is happening with a lot of technology markets. Cost of money is high, funding is a little limited, right? Are you seeing that in the PERS space as well? Obviously, senior care, one of the big drivers of it is, of course, we see the population growing, staffing on healthcare shortages. There's a lot of drivers here, but in the immediate term, right, the attention for smart home and funding, how are you seeing that playing out?
Yeah, I mean, I think it's beyond even this space. I mean, we actually saw this in our remote guarding and video monitoring space. That employee costs are sky high, and so we've replaced guards across the country with video monitoring. And likewise in the home, we've partnered with home health agencies and other groups that are being asked to protect more and more individuals, maybe add new services that will provide a lower level of care. And so to answer your question, yeah, that I think that these services are a replacement for when we can have an actual person in the home to provide that service. And it is a challenge. I think other countries are more advanced in this in some regards. Some countries like Korea or Japan are experiencing really large challenges due to the decrease in population as a whole, and an increase in their aging population as they're having fewer children and fewer people to take care of the aging population. And so innovating tools and services to monitor large populations of individuals and without decreasing the level of care is really key. And we're actually seeing this in this independent living and senior living spaces. How do we monitor groups of people, not just provide emergency response, but how do we actually see if they're okay? And so we are partnering with groups and really honing in on this idea of a wellness score and understanding, can we gather data to help us keep an eye on these groups of people when they may not have loved ones or others nearby, or they don't have any loved ones, so that they are getting a sense that they're being watched for and cared for, even if somebody can't be in their actual apartment or room every single day.
Great. So you've spurred all sorts of great conversation in the chat here. Lots of interesting questions coming in. One about whether or not you see the demand for devices that can provide even more comprehensive health monitoring, whether that be for seniors specifically or the general population, right? So we've talked about activities of daily living, obviously safety concerns. There's the whole vital sign bucket, which is regulated in a different way, maybe different type of devices. And then on the other hand, Kristen talked about how actually there's a lot of growth in the non-senior population for monitoring your health as well. So what are your thoughts on kind of more comprehensive view into what's happening with your health?
Yeah, great question, and something we're looking at. We do manufacture, we design our own devices, we're bringing those to market. And so one thing we keep our eye on is kind of this intersection of these large companies, Apple, Samsung, and others that do have smart wearable devices and the features that they're providing really in this consumer health world. I've spoken to many physicians, clinicians that have said, the Apple Watch or the Samsung Gear, these are great. If I have a patient reach out to me and they say, hey, I had an event last night, according to my watch, my heart rate was elevated. That's probably one of the greatest things that's happened in recent history for providing proactive care on a consumer basis. We are also doing things like this in our space and trying to provide devices that can advance the data that we collect. I think one data point that I'll bring up here, and I think something that's been challenging that we're all trying to solve, is if you need participation by the resident, the senior, the aging population, or whomever we're tracking, even if it's a worker, if they need to put a device on, if they need to step on a scale, or if they need to do an actual test over time, and this became really evident in 2020 and beyond with RPM, participation was just a huge problem. Compliance was a problem because we're not passively collecting this data, and we're requiring the users to do what we think they should do: step on the scale, check their blood pressure. And so we really need to continue moving technology in the direction of passively collecting this data so that we make it easier on the user, specifically on the aging population. It can be very challenging to remember to weigh themselves or remember to do a blood pressure test. So we are looking at ways to passively do that to mitigate some of the challenges of needing to do the active test. We have used our AI and engagement platforms to remind and to encourage that positive behavior, but we are always looking at technology. I think one of the ones that's most challenging, there are devices out there that are gathering blood pressure information on the wrist, but very challenging still. I think technology, and it's highly regulated. What's accurate, what isn't accurate. But I think some of the lower hanging fruit, obviously, pulse, heart rate, oxygen levels, and even heat or temperature sensing is information that we're able to passively provide much better.
Awesome. I'm glad you brought up AI, because I was going to ask about that. Your great video really touched on the AI pieces of the platform when we're talking about activities of daily living, flagging abnormalities. A lot of that is AI and really trying to push the industry from this very kind of reactive approach to maybe being more proactive. And then the question I had for you is then how do we get to using it for engagement? Obviously, generative AI, conversational AI tools are meant to be creative or that conversational, right? So how do you see AI playing in kind of maybe the next wave of innovation here in the industry, where we move from reactive to proactive to engaging?
Yeah, great question. We started building an AI platform several years ago. It's probably been 5 years, and we've literally taken millions of inbound calls and really been trying to hone our skills on this idea of collecting a quantitative answer versus a qualitative answer. And what we found is often if you ask people a yes or no question, they don't give you a yes or no answer. And we really like this idea of mixing technology, AI, with the human element and combining that to create positive outcomes. And so today what we are doing is we're gathering data, and we're hearing these answers that are sometimes yes or no answer or questions, but not always yes or no answers. And we're collecting that to say, what did they really intend by the way they answered this question? We've seen specifically with seniors that they're very reluctant to ask for help. And so if you call somebody and you say, how are you feeling? Sometimes you'll be getting a question, well, I'm okay, but in reality, they're not doing okay. So can we actually hear in their voice that they're not doing as well as they think they're doing? And can we create actions based off of that? And really it comes off of handling millions of calls and collecting that data and tuning the model so that we're providing better outcomes. Oftentimes, and again, I spoke about this in my presentation briefly, if we're seeing behavior that doesn't look desirable, can we reach out and ask questions to prevent the next event from happening? And that's really how we train that model to be more proactive, and then beyond that, getting it to be engaging where the user's expecting this to happen. They're actually happy to provide this information. They know that they're going to be asked how they're feeling. They know that they're going to be asked if they've been eating and if they've been sleeping well.
Okay, I think we have time for just one more question. So I wanted to bring an audience question around integration. So I think we're going to see more and more of these types of services and technologies that you've developed over all these decades in the market, moving into senior type facilities. How important is what you're doing? The need to integrate with other systems in senior care facilities? Are your platforms meant to kind of be a standalone complete kit, or are there workflow solutions or other types of systems, a Wi-Fi network, perhaps in the facility? Where do you see that kind of integration need happening?
Yeah, great question. So we do have a variety of solutions when we're talking about the actual devices and equipment. It can be standalone devices that operate on Verizon or AT&T. We have devices that operate on the cellular networks. But as far as integration goes, if you have, we integrate with the devices, the applications, all of that can be installed. It can operate off of, your systems off of the cellular networks. And so that's a pretty easy problem to solve. As far as integration from a platform perspective and getting data back to our partners, we have created a suite of APIs and integration tools that allow us and our partners to provide that information back to you so that you can take action on these insights that come in. And so we do have a dashboard. So if we have a partner out there that's maybe smaller in size, they don't look to do technology integrations, we do have dashboards and tools that they can use to get some of the same outcomes. Some of our larger partners prefer to get the data and the insights streamed right into their software, whether it's their EHR or into other programs like a CRM. We can do that as well.
Well, Brock, thank you so much for your time and sharing your experience and leadership with us today. Really appreciate your insights.
Thank you. Thank you for the opportunity.
Absolutely. And give us just another minute and we'll be back with our panel discussion.
Thanks, Brock, and thanks, Jennifer. That's a wonderful discussion. Next up, we have our panel discussion on the topic of connected devices and strategies. Joining me today are Dr. Natalie Davis, co-founder and chief medical officer of PreventScripts, who I will call Dr. Davis since there are two Natalies with us. Other Natalie is Natalie Schibell, VP of Marketing Strategy, Intelligence, and Insights at Zyter TruCare. We also have joining us today Thomas Serval, CEO and co-founder of Baracoda Daily Healthtech, as well as Davide Vigano, CEO and co-founder of Sensoria Health. Dr. Davis, can you maybe take just a couple of minutes to tell us a little bit about yourself and about PreventScripts?
Hi there. Thanks so much, everyone, for being here today and looking forward to the discussion. I'm Dr. Natalie Davis. I am a pediatrician, originally from Kentucky, did my medical school at University of Kentucky, my pediatrics at Washington University, St. Louis. And after practicing in St. Louis for nearly a decade, moved back home to Kentucky and just noticed that colleagues, friends from high school were dying suddenly in their 50s of cardiometabolic disorders. And it didn't sit right with me. Simultaneously, patients were coming in using apps, various consumer apps. And I just sort of saw this trickle of engagement in their minds. And then my immediate next thought was, I didn't provide that value. A mobile app provided that value. And then the next thought is that wouldn't it be great as a provider to have access to that data in the back end, the patient's user data? And so this is how I came together with my co-founders and we created PreventScripts, which is a decision support platform to help primary care providers identify risk and stratify their population by motivation levels. And then we pair that with custom interventions according to the patient's stage of change and condition.
We're very happy to have you here with us today, Dr. Davis, and very much looking forward to hearing your perspective on some of these different topics.
Thank you.
Also joining us today, Natalie Schibell, VP of Marketing Strategy, Intelligence, and Insights at Zyter TruCare. Natalie, can you maybe tell us a little bit about yourself, about your background? You have had a very storied career.
Sure. Thanks so much for having me. Hi, everyone. I'm Natalie Schibell. I'm the VP of Marketing Strategy, Intelligence, and Insights at Zyter TruCare. I've been here for about a year, but my former life was as an analyst at Forrester Research, where I served as VP Research Director. And before that, a VP Principal Analyst, looking at emerging technologies, retail health, predictions and trends. Was a wonderful time there and got to work with some amazing people. Prior to that, I spent a year with the Centers for Disease Control, mitigating the COVID-19 response, specifically on the National Wastewater Surveillance System. And I spent a total of 12 years in the U.S. Navy, combined active duty and reserve, as an environmental health officer, which is a specialty of the Medical Service Corps. So not the most traditional path to marketing, but absolutely each thing in my background certainly contributed to what I'm doing at Zyter TruCare today. Zyter TruCare is a leading clinically driven AI-powered healthcare and services company. Our main mission is to deliver optimal health outcomes through integrated care solutions that focus on value-based healthcare for our clients. We help our clients enhance health outcomes, reduce healthcare costs, and provide exceptional experiences for both their patients and their members. And as a value-based care enablement company, we offer comprehensive solutions for population health management, and that includes advanced care, case and utilization management. Our key capabilities include integrated tools for case management and longitudinal care, optimization of resource use to reduce costs, and enhance claims processing and administrative capabilities. We also provide advanced data analytics for patient tracking and outcomes measurement, tools for quality measurement and reporting, and medication management services to ensure patient safety and adherence. Additionally, we support health services at the home and in the community through our home and community services. You see all of our solutions on the PowerPoint slide there. They're all cloud-based and modular, ensuring flexibility, scalability, and ease of integration. We leverage AI into all of our solutions to drive smarter, data-driven decisions. We have features like prior authorization intake, HEDIS care gap insights, and automated pre-call summaries. I also want to stress that security and compliance is very important to us. We are HITRUST certified, adhering to stringent security protocols and privacy regulations to safeguard our patient and member data. We're very proud of our strong market presence. We currently serve over 45 million patients and members with our solutions. Our customer base includes providers, payers, and the government, including two of the largest health plans in the United States. Looking ahead, we're focused on advancing our AI capabilities. We're committed to fostering long-term partnerships with health plans to help them enhance their members' health outcomes, reduce costs, and improve patient experiences. I'd also be remiss if I didn't mention that next week we're having a huge release, release 24.1. We'll be hosting a release week that starts on Monday the 24th and extends through June 28th. So be sure to head to Zyter.com, connect with us on social media, and that's where you can hear about all our latest product features and read about our thought leadership. That's a quick snapshot of Zyter TruCare. Happy to follow up after the call if anyone has any additional questions or would like a demo. So thank you very much for having me. And I look forward to today's discussion.
Thanks, Natalie. We're very happy to have you here as well. Very much looking forward to kind of hearing what you have to say on some of these different topics. Right. Next, we have Thomas Serval, CEO and co-founder of Baracoda Daily Healthtech. Thomas, can you tell us maybe a bit about yourself and about your company? And apologies if I'm not pronouncing your name right.
It's perfect. So good afternoon or morning, everybody. So I'm Thomas Serval. I'm based in Europe, in Paris. Baracoda, in a nutshell, is an inventor of connected device focused on preventive healthcare. What we do and what we have been planning on doing is really turning your bathroom into a primary point of care. Initially, we started inventing smart toothbrushes. So we were the first to integrate AI in a toothbrush to check the way you are brushing your teeth, addressing a $120 billion market. But down the road, because we had this partnership with Colgate, we started looking at how can we use the data we can collect in the bathroom to actually have a better understanding of people's behavior. And we built a platform we call BeConnect, which is to summarize a platform to take good habits. Since a lot of the preventive healthcare is based on improper or poor hygiene habits, washing your hand, brushing your teeth, and it has a huge impact on people's health. So after our smart toothbrush success, we started developing CareOS, which is an operating system for the bathroom, which manage privacy and security of the data, as well as a simple, seamless interaction. So it can be addressed by even children or elderly. And then we started inventing another product called BeBalance, which is a smart bath mat on which you walk every day, and it tracks your weight, your balance, and your posture. And in recent development, we are actually about to certify it in the United States for fall detection. We have been able to establish using AI and some significant clinical research the ability to detect your risk of falling, which happens to be a reversible risk, because we also provide with our BeBalance product the ability to train yourself to regain some of your balance. So this is particularly useful in elderly care. One of the last two inventions we had is a bracelet that goes onto any watch that uses body energy. So the temperature generated by the energy of the body to self-power itself and track your HRV, your activity, and your temperature. So that allows us to provide those bracelets to workers or to elderly who usually and very often forget to recharge their smartwatches. And last but not least, at CES this year, we introduced B Mirror, which has a Be Mind feature to address the small and very light mental diseases when you have a little bit of a low moment or a little low depression. Trying to tackle the 25% of population that has sometimes a little down moment. We were able to use a small language model as well as advanced AI detection to understand people's voice, what they are saying, what their posture is, and to be able to assess in which mindset they are and triggers different response, ranging from simple meditation to call the emergency services if we believe the situation is very serious. So turning your bathroom into a point of care using this unifying platform we call BeConnect that allows us to harvest a lot of data, whether they are medical data or healthcare data or well-being data or even environmental data. And with these new tools, mirrors, toothbrushes, wristband, and more to come, we try to make your bathroom really a place for you to stay longer, healthier in your home. Thank you very much and looking forward for the discussion.
Yes, thank you very much for joining us, and very much looking forward to hear what you have to say. We are going to talk a little bit about independent living, aging in place, and some of the solutions there. So hoping to dive more into that topic especially. But yes, last and certainly not least, we have with us here today, Davide, apologies, I know I'm pronouncing your name wrong, Vigano, CEO, co-founder, Sensoria. Did I get it?
Thank you. My name is Davide Vigano, but I respond to almost anything by now, so appreciate your introduction. I'm co-founder and CEO of Sensoria. Sensoria is based in Redmond, Washington. A little bit about my background. I'm a former Microsoft. I spent over 23 years with the company. Joined as an intern, left as a partner level executive a few years ago. I was in charge of the healthcare products, Health Vault and Amalga before Azure and AWS were created. Those were my products before they were sold to GE. At that time, we decided to leave the company, and we realized that people are simply not using their medical devices. Adherence is plaguing the medical device industry, primarily when we are asking patients to do something at home. And the previous presenter, actually Brock, talked about the necessity of collecting data in a passive way. Well, we all wake up in the morning and we do the same things as consumers before patients. Most of us wake up, most of us take a shower, and probably all of us in general put our clothes on. So we put garments and footwear products on. That's part of the consumer workflow. So our hypothesis with Sensoria was, how do we convert every single piece of clothing into something that is a biometric sensing data collection platform, all the way from the most commonly used garments and footwear, all the way to mobile applications and cloud systems. The name Sensoria means data fusion, sensor, and IA in Italian means intelligenza artificiale, which is, of course, AI. So it's actually spelled the opposite way, but it means exactly the same thing. We started the company over 8 years ago with the vision that artificial intelligence would change healthcare. Since then, we have been able to deliver on our vision to convert even the most commonly used textile garments into biometric sensing data collection, passive data collection devices. Let me underline passive. So just to make it more fun, this is a sock, looks like a sock, feels like a sock, but we have been able to design develop and deliver textile pressure sensors that we can embed at the plantar area of the foot. And the sensors, the textile pressure sensors, communicate to a 9-axis IMU. We call this Sensoria core. Is a square inch in size and a third of an ounce in weight. And this device collects, of course, gait assessment data. So we can actually see balance data. We can see step time variability data. We can see basically all the gait metrics that clinicians study in med school to collect and predict potentially the risk of fall. We have developed a dedicated mobile application called Sensoria Walk, which is free and available on the Google App Store right now. I encourage you to take a look at it. We are honored to work with the Michael J. Fox Foundation for Parkinson's patients. We're honored to work with the Shepherd Institute in Atlanta on multiple sclerosis patients. We're really extending the Gait Lab outside of the lab. Another example of one of our solutions is the clinically validated boot that you see here. This is called Defender. It's a mechanically offloading boot for diabetic foot ulceration. The same exact Sensoria core device with a different packaging is monitoring adherence and activity for people that suffer from diabetic foot ulceration. In this country, we still have over 65,000 amputations every year just due to diabetes. That's an amputation every 20 seconds. Life expectancy of a patient after an amputation is 5 years, same as the most aggressive cancers. The cost at the federal level is $17.5 billion a year. Just the VA spends $2.5 billion a year on foot-related complications. I would argue that it's medieval to perform amputations, and there are technologies that can actually reduce and prevent amputations. The system that you've seen here has been clinically validated as a new gold standard by Baylor College of Medicine and USC Keck School of Medicine. So envision a time when everything around us, including whatever we decide to wear, can actually be connected to a smartphone or a smartwatch and drive the data to the cloud and interface with the patient for behavioral feedback in real time. Now, what we're doing is working with Microsoft on OpenAI to timestamp the data coming from the sensors with the voice feedback from the patient. So self-reported patient data will have an agent interface in the cloud that allows us to actually collect quantified data that tells us exactly what the patient is doing with self-reported patient data, which will tell us what the patient thinks he or she is experiencing and doing. And 22,000 physical therapists resigned the year after the pandemic in this country. So we call this beneficial intelligence because unlike other industries, we're not disintermediating jobs. We're just helping people do their jobs better and focus their efforts on the patients that need human help the most. The machine should be able to help the other patients. With that, I look forward to the conversation.
So very happy to have you here with us, Davide. I'm very much looking forward to diving into the meat of this discussion. So let's bring in everyone so we can all kind of get together, talk. So we had a chance last week to chat a little bit about kind of what was going on in the industry, some of the kind of very important different factors. Something that really came up, that there is this mountain of evidence showing that digital therapeutics work, that these device-based interventions work. When it comes to addressing a lot of different chronic conditions, a lot of different acute conditions. So what are some of these remaining barriers that are keeping them from being really more widely deployed? And maybe Dr. Davis, you can kick us off here. Oh, I think you're on mute.
Sorry, guys. As a provider, we have lots of problems, right? Extreme burnout, we can go down the list, and I'm preaching to the choir here, but what we found to be most useful in terms of overcoming barriers for providers to utilize our technology was really two things. Number one being finding a very exact business model for the providers to be able to actually launch a true preventive service line that is able to help them roll our product out to their patients, but in a way that's reimbursable and has a return on investment of 5 to 1. And then the second problem that providers have is they don't really understand which patients are motivated and ready to do an intervention. They don't, the conversation around weight and metabolic syndrome is a delicate one. And so part of their fear in talking with patients is not bringing it up at the right time, or patients not being ready to talk about behavior change. And so part of our work is to streamline that process and to sort of serve up these patients that are ready to talk about behavior change and weight and metabolic syndrome. So I love David's product. I can't wait to hear more about it, because I'm ready to get some socks, for some of our remote monitoring enrolled patients, and to partner with him. But we are working very, very upstream of this. We're working in the 13 to younger elder 74 age group in a very upstream preventive approach. And so for providers, two things: revenue model. Number two, understanding which patients are good candidates for these interventions. And then I'd add a quick third thing. Big problem for patients is there's no shortage of patient-generated data, right? There's a fire hose of data coming in. But from the provider's perspective, the data is not actionable. It's not filtered, number two. And number three, it's not coming into me at a time when I can actually do something about it. So it's not coming in at the right time of my day when I'm seeing 40 patients to be able to create an actionable event. And so those are really the three top provider problems we have been working to solve with PreventScripts.
Yes, I think the how do I get paid is kind of one of the biggest challenges here too, and complicated, of course, by the ongoing transition we're trying to do to value-based care, and the fact that we're still kind of stuck in this reimbursement model.
Right. It's a two-sided, if you sort of imagine this cycle, the RVU rev cycle, right? That's going, but then you have the upside risk cycle, and even, many providers that are moving into full risk. And so really the challenge is to straddle those two business models and to be able to help providers successfully cross that hurdle from one into the next. And so with our customers, we take some risk as well.
Yes, there is that. Yeah, that element is still there. So kind of talking about some of these different barriers in place, kind of what is maybe keeping kind of the healthcare industry from more widely deploying some of these technologies. Natalie, you've been studying these markets as well, kind of in kind of your past roles, your present roles. Kind of what are you seeing?
Sure. Absolutely echo everything that Dr. Davis mentioned. And I also wanted to open the door on data privacy and security concerns. That's a significant barrier today. We all have heard about the Change Healthcare cybersecurity attack. They're still doing estimates, but they're estimating by the time the numbers are calculated, about a third of the American population will be affected by the cybersecurity breach. So when you're looking at digital therapeutics, it's a tremendous amount of data. In 2022, it was actually over 2,000 exabytes of data. 1 exabyte is 1,000 petabytes. So a tremendous amount of data. How do we harness that data? How do we make sure that it's secure from breaches and misuse? That's a paramount challenge that we have to look at. And when you have a data breach, it can erode trust and deter a lot of patients and providers from using digital health solutions. So companies really need to invest in cybersecurity measures and comply with regulations like HIPAA here in the US, GDPR in Europe. That can be costly and it can be complex, especially for smaller startup companies getting involved. My research at Forrester really highlighted evolving security threats are a major concern, particularly as decentralized clinical trials are now becoming more popular, as well as remote work and real-world data collection is gaining traction. And so we have to be mindful of that when we're developing these solutions. I also want to focus on interoperability with all this data. There has to be open standards so that we can get this data into electronic health records so that physicians can use it and use it at the right time and can actually act on data. Echoing what Dr. Davis said, I think that's super important, and that to be really competitive in the remote patient monitoring industry, in addition to all the data flow that providers need to have access to, there needs to be a team that augments and that can review the data and work with care teams when they don't have enough staff to take on that type of responsibility. And I think that's really important as the prevalence of chronic disease is rising, right? 4 out of 10 have 1 or more chronic diseases. Actually 2 or more chronic diseases, and we have an aging population. By 2030, 20% will be over the age of 65. So I think that's going to be 2 main focus areas that we need to look at when advancing this technology sector.
Yes, there is going to be just incredibly enormous need, I think, for preventative care, both really today, we need it today, but also especially over the next few decades when we're going to see, kind of, as you said, this increasingly aging population. We have had an ongoing obesity epidemic, so metabolic disease is kind of increasingly prominent. So maybe diving in a little bit deeper on this topic of kind of preventative care, value-based care. Davide and Tomas, you both mentioned kind of some of the different solutions that you had in the market today. So really hoping to, looking to kind of take on this question of improving care outcomes with these preventative solutions. Different stages of prevention, I would say. Tomas, you're more about kind of earlier up in the stream, as Dr. Davis was saying, and Davide, you're more focused on, okay, we've already had maybe 1 incident. How do we prevent more? How do we get the patient really back on track? Can you talk maybe a little bit about kind of what is going on in this market for preventative care, kind of in the different aspects you are, and of course, Tomas, you're serving more the French market, so not necessarily fully active in the US, but you're looking at that entry.
So actually, we are not. There is no market in France. So to make things simple, if we were sticking to the French market, we would be dead for 5 years. So there is absolutely no market in France for preventive primary care. So basically, we have to play with compliance. So that's tertiary prevention, as it's labeled in at least in Europe, which basically has the best and most stable business model. We are talking about, you have a condition and we want to make sure you're taking your drugs, or you're taking you're putting your drops correctly if you are talking about eye care, etc. So the only place where there is a solvent market for now in Europe, or at least in France, will be tertiary care. And basically going back to the business model issue is actually everybody has something to win in a better hygiene, but there is no path for changing people's behavior. And it's blocked on many ways. One is from a consumer behavior, unless you have a strong condition, and you have no choice. So this moment of life where you are being diagnosed, a chronic disease, etc., and you have to change your lifestyle, people are very negligent, and they have also a lot of cognitive bias. I give you an example, which is not medical data, but if I ask you how long you brush your teeth, you will answer on average 1 minute 30 seconds. On average, if you measure it, it's going to be between 30 to 45 seconds average. So there is a cognitive bias. You don't want to acknowledge the truth. The good news about that is now we can measure almost everything. So we have a baseline and we can see how we improve. But even if you have the proper diagnosis, your ability and willingness to improve will really depend on the incentives. And that goes back to another point that have been raised, which is your receptivity to incentive will very, very much vary for who you are, what you do, in which situation you are. You know, some people, if they are very low income, will react very positively to cash income. If you are pretty wealthy, it's a reputation option that will be better off. And so we need to figure out the right triggers to drive the right behavior. But even if we do that, so if I go and then we have solve all those issues, the payers problem is not easy to solve. In France, to give you the example, the US is we have 3 payers. The customer, very little. You have the private insurer, quite like 1/3, but everything that is serious is fully paid out by the state. So it means if you end up having cancer, then it will be fully reimbursed for the rest of your life by the state, which is amazing if you are a French citizen and you are sick, because you will be given proper care. But for you to be active and proactively preventing you from having any serious situation, even in places where a diagnosis or some genomics diagnosis could happen to help you reduce or delay this risk, nobody is quite ready to pay for it. And that's kind of a structural challenge. We don't see the same thing happening in geography. So what we see in terms of momentum in the business model is the people who are the most keen to invest in this are not the most advanced country. The country where the ratio between providers and customers or patients is the highest. So typically, to have a proper care in a developed country, you're looking for 3 physicians for 1,000 citizens. We are now having very, very good traction in countries like Middle East or Africa or India, where the de facto ratio, because of the shortage of patient or of providers' time, is 1 to 10,000 or 1 to 100,000. So right now, what's happening for us, which created a terrific momentum for us, is we are involved in building those new cities where healthcare will be built in. We're going to collect and build a bathroom of the future from the new Neom city in the Saudis, or new building being built in India, where we will have carbon neutral homes, as well as healthcare ready homes, where the sensor will be ready, where they need to be reversible, but basically the business model might be fully embedded into building a new system. So somehow, a little bit like mobile phone in China, we are more and more seeing this preventive healthcare leapfrogging the existing system to going where you have no options. This is where it's easier to adopt AI as a replacement for doctors for triage, and actually allows to do even better medicine, because even if you are very wealthy, like in the UAE, and you have all the money of the world, no very, very well-known physician that has a beautiful home in New York will be willing to move to 120 Fahrenheit during the summer to do some surgery. So you can build the best possible hospital. The talents will not move. So telemedicine, remote monitoring, all those things will be part of the solution. And the more and more we see ourselves moving into this model of really redesigning the home and redesigning the people's data collection and interaction with the healthcare system in those new cities. We hope we will have the same momentum in the US. But the payers as well are very, very careful because somehow the way they manage is basically cost plus. So they are not fully insuring you, they are redistributing costs. Meaning if the cost of healthcare increase, basically is going to be paid off by the employers, unless they are paying for themselves, where we see also a little bit of momentum, but I don't want to be too long. And I can tell you a little bit more about what we see moving in the States, mostly for companies who have captive insurance companies, so they are self-insured and are directly paying the price of their healthcare for their employees if they are scared.
Yes, I think there's different, as you're saying, different barriers in different countries, different opportunities. Lots of places kind of around the world, they don't have maybe this kind of embedded mass of existing systems with kind of all the stakeholders already in place, the processes that might impede kind of progress. So yes, and Davide, actually, I'm very interested in hearing what you have to say here as well. So looking at kind of the digital therapeutics and the barriers, and especially with preventative care. Oh, is my audio? Oh, Davide, can you hear me?
Yes. Oh, yeah, absolutely. Okay. So in terms of what you asked, I think the cool thing is that in the US, incentives have never been as aligned, right? So the cool thing is that some of these new biomarkers, digital biomarkers, can now be collected at the cloud level, and the machine can actually screen those digital biomarkers without the intervention of a provider, as long as the provider or the researcher has defined what we call ranges of normality. But the cool thing is that the most advantageous thing is that some of these devices are now covered by Medicare. The device that I showed you before, this device here now is covered by an L code. The remote patient monitoring is covered by CPT codes and by MIPS incentives as well. From January of this year, a podiatry practice can actually implement a system where they can actually not only have the full system reimbursed, but also reduce the risk of penalties related to value-based incentives. So MIPS allows up to 9% bonus on overall Medicare revenues, right? So there is actually a very, very much aligned incentive when it comes to some of these new solutions. And of course, at the federal level, the capabilities that we have can also reduce the cost for the taxpayer. So we call this a win-win-win, right? It's a win for the patient. In this case, is preventing an amputation. In the case of a clinician, we focus the clinician's time on the patients that really need help the most. And the last but not least, the cost implications that I just discussed are dramatic at the macroeconomic level. So that is why we think that there is an opportunity to actually implement a new model of care that is based on value-based care and is based on data and beneficial intelligence algorithms.
Yes, I would certainly agree. So yes, and as a reminder to the audience, we are going to be stopping for some questions. So if you have any questions you would like to ask any of us, please make sure to put that in the chat. All right. So yes, I guess another question for me. So we are seeing kind of the market for devices evolve, the market for solutions evolve. Kind of where are we seeing the most traction right now? I mean, we've been doing a lot of talking around kind of preventative care. I think a lot of the audience members are very interested also in independent living, aging in place, and some of the traction we're seeing in that market. But there's also kind of this shift towards more personalized services with AI, patient engagement solutions and strategies, integrations with virtual care platforms. So kind of where are we seeing the market evolve? And then kind of really open for anyone. I know, Natalie, you mentioned you were seeing some very exciting things going on with independent living. Natalie Schibell.
I can chime in here just really quickly on the two, we started in sort of upstream prevention, thinking we'd work on this early at-risk population. What we found as we developed our relationships with customers and evolving customers, we had to move a little downstream to meet their needs. And so that's when we developed a hypertension product as well as a diabetes product. And so now we're even moving into, in a co-development project, into a heart failure module, as well as that teenage obesity group, because the average age of type 2 diabetes diagnosis in kids, unfortunately, is 14. So if you wait to 17, you've waited too long. So, we have a lot of middle schoolers and early high schoolers with severe metabolic syndrome. And this is a disease that just crashes into, chronic disease and kidney failure very, very quickly. So, we've expanded according to our customer feedback, and that teenage as well as the older heart failure group are two very key interests that providers have.
Yes, especially with teenagers. I can just envision this really affecting the rest of their lives. So best to take care of it really as soon as possible.
Yeah, I agree. Only 23% of the adult population is active today. So, When we look at the potential for smart wearables, that's particularly exciting. About 30% of adults use wearable health devices today, everything from fitness trackers and smartwatches to help monitor their health. But we have to now spread that to those individuals who are not already wearing them, to some of the, especially to our adolescent youth, so that we can help reinforce good health habits. In terms of connected health devices, about 80 million Americans are using those devices, such as blood pressure monitors, glucose monitors, and smart scales. They're helping with chronic disease management, reducing potentially avoidable hospital visits and readmissions, and helping to improve patient outcomes. The global digital health market, including those connected health devices, is humongous. It's projected to reach about $510 billion by next year. And this is only going to continue to grow. So lots of potential there, to help more Americans utilize these devices and get more comfortable with them.
Yes, I'd say an absolute lot of potential. And Davide, you mentioned a little bit earlier as well, one of the new use cases and applications you were looking for with your own current solution. So potentially kind of talking with Microsoft and OpenAI to have the audio notes. Something I'm interested in, what is the impact of Gen AI maybe on a little bit of what we're doing here in terms of kind of better serving patients and maybe collecting more types of data that we haven't been able to before?
Sure. That's a great question, Kristen. I think you probably know that Microsoft acquired a company called Nuance a couple of years ago. Their product was called Dragon. I'm sure Dr. Davis knows that. I mean, of course, it's all about collecting and dictation of notes. Now, imagine extending note-taking to the patient. Why should the clinician take notes? I mean, the patient is probably better equipped to take his own notes, right? So why don't we just really delegate that part of that function to the patient? And that's what large language models and SLM as well, so edge computing SLMs can do. I don't know if I can actually share my screen here, but I'd love to actually show you what that means if you'd like. So imagine a patient at high risk of fall. So imagine a patient with peripheral neuropathy. Imagine a patient with a neurological condition like MS or Parkinson's. And now imagine collecting real-time dynamic balance data from just wearing socks. That patient is probably wearing socks every day anyway. So we're not changing the human behavior. We're just simply asking the patient to keep doing what he has done for his last years of his life, right? So at the same time, that patient can talk to a smartwatch application and just simply say, I'm experiencing a freeze of gait event. Freeze of gait fog. Freeze of gait event is very, very common in Parkinson's patients, as an example. So talking about data, one patient out of three in this country, when a person, actually a healthy person, over 65 years of age falls each year. For a Parkinson's patient at the same age, the risk of falls is 5 times that, right? So, and when there is a freeze of gait event, imagine being able to have a therapeutic component that we're actually embedding now into the sock. So we're actually putting small haptic motors into the sock that allow the patient to tap on a smartwatch and engage those motors with the vibration of an intensity and a frequency that a neurologist has defined for them. There is no interaction with the clinician. The clinician has already prescribed the digital biomarker interaction. Of course, this has broad implications about med compliance. So let's assume that patient is not walking. There is a degradation of gait. The first thing that the agent, the beneficial intelligence agent, is going to tell the patient is, did you take your medicines today? If the patient responds with voice, yes, I did, then of course there is an escalation of care, because guess what? The cocktail of drugs that patient is taking, the efficacy of that is just not there anymore, right? So I'm sure Dr. Davis would want to know at that point, only when the patient has already said, number one, there is a degradation of gait. Number two, I'm not I haven't, I have taken my drugs this morning, and this is the way I'm walking right now. I don't feel good. I don't feel good at all. And the quantified data confirms the self-reported patient data. That is where beneficial intelligence and large language models come into play.
Yes. Oh, Tomas, if you're talking, I think you're on mute.
Okay, so sorry. Baracoda is one of the largest team of AI. French has some keen interest in AI, and we are kind of big in AI. So we have one of the largest AI healthcare team in France. So we are working on a large language model and small language model in various applications. One thing I think is not properly captured when people look at large language model is they try to reduce it into language. But basically, we have sign language. We have many ways to express and provide a language beyond what human would call a language. And that is allowing and enabling us to do some revolution in terms of interface. In our smart mirrors, in our smart bath mat, basically what we know works is to be invisible. And one of the true disruption that the recent large and small language model have provided is provided multimodal information, whether it's your voice or your posture or some data sets that we can collect with all the biometrics sensor that exists around us. We can define some kind of a richer language about your condition, and that allows us to not interfere with your daily life unless there is something important to be said, which we know every time we ask any patient or any user to do something extra, it's like the extra click, which will make you drop 80% in taking good habits and in even the adherence to the compliance to a prescription. Simplicity and invisibility are kind of the most important factors, and so we have many evidence of that. And another example of the use of large language model is how to make providers save time. The really rare value that everybody is trying to save is people's time. The level of capability right now of large language model combined with what is called RAG, which is basically database access, because you don't want to be creative in what you do, is providing an incredible productivity tool. So one of the latest projects we have been involved with is, and it's going to be a product we're going to launch in the coming months, is a product that generates, based on all those interface with you, personalized programs about activity, nutrition. We are trying to address non-medical stuff that have a medical impact. So in that regard, we are avoiding the long time that FDA marking will require, but basically generating automatically your routine of what you should do and not do in a purely unique way that will be rewritten in a way that will be compelling to you based on your psychological mindset is what large language model allow us to do in an incredibly fast manner. I mean, we are talking about stuff that we have developed in the last 6 months based on the latest progress being made on those open source models as well.
Yeah, so certainly a lot of different potential applications and a lot more to come.
Yeah.
Yes, I know we're a little bit over time, but we do have some interesting questions in from the audience, and I'd like to tackle at least one, if you can bear with me. Audience wants to know, what health policy decisions do you see really as needed to incentivize consumer use, tech industry, the provider community, and what kind of objective? Longevity, wellness, cost reduction, universal access?
I think the biggest thing for patients that we see, in particular, sort of rural and underserved, under-resourced communities, it's not that patients don't want to change their behavior. Nobody wants to have an amputation and have to sort of succumb to the fate of the American food and lifestyle. But what patients want is they need to be met where they are. they cannot, handle this sort of kitchen sink that we do in our physician visits. It's do this, do this, do this, do this, do this. And that's not how behavior change works. Patients can do the one thing. And that is what we really sort of drilled down on in our platform, to allow patients to set their own goals within our My Plans feature, which allows them to say, okay, this week I'm going to focus on eating less sugar. But it's hard because my husband brings home all the Pringles. So what are the things you can do this week? So in an automated, digitized survey, the patients can meet their own goals. And it's not that consumers don't want to change their behavior or patients don't want to change their behavior. It's that it's too complicated. It's too hard. It has to be broken down into tiny little bite-sized pieces week by week. And it's best if patients are setting their own goals without the provider projecting what they think the patient should be doing.
Yeah, if I can add one point, since I think the question was related also to overall federal level policies. I think incentivizing anything that is going towards the win-win-win type of approach that we talked about, it, right? If it is good for the patient, if it is good for a clinician, if it is good for a taxpayer, we should incentivize the use of beneficial, or I call it beneficial intelligence, because there is nothing artificial about it, right? So in this case, it's very pragmatic and very meaningful. And I think from a legislative perspective, there is a need to not just think about the negative potential impact of artificial intelligence, but also incentivize the beneficial components of artificial intelligence.
If I may add another point, which there, in everything that saves money, it's very hard to finance the research that will support it. If you are a drug provider and you are selling cancer drugs, basically you want to prove that your drugs works. But if you are providing something which can be just a DTX that will change people's behavior, who's ready to pay for it? So there is a fundamental where the government needs to play a role, and it's worldwide, not only is basically how do you fund preventive research? And there is a big gap between the amounts of money that can be provided to drugs research to increase care of patients and all the things that are free to use or free to do, and under which we now have the data collection with what is called real data. We have access to so many databases, but nobody is fully incentivized to do it. And that should be the golden prize where most of the money of the government should go, because private money will always fund drugs discovery. But who will pay for the research on preventive healthcare? We are still looking for it.
Yes, I think what we've seen with drugs is if you're able to make enough money with it, people will do it. So how do you have people make money with preventative care?
I'd like to expand on that just for a moment. And there's really a need for expanding reimbursement for RPM services to cover a wider range of conditions and patient populations. Right now, RPM reimbursement is often limited to specific conditions such as chronic diseases. So there's a huge need to expand coverage to include acute care management, post-operative care, preventive care, and that could really help broaden the use of RPM. So I think that's something that we really need to focus on with the increased prevalence of chronic diseases that we see today.
Yes, absolutely. Very much agree. We are a little bit over time. Unfortunately, this was a wonderful discussion and very happy to kind of chat with all of you, hear your thoughts. Very much appreciated.
Thank you very much.
Absolutely. It's been a pleasure.